what happens when a survivor of trafficking goes to the doctor? Let's talk about something that people might not be aware of when victims of trafficking are trying to recover and build a new life of freedom. Healthcare. One of the biggest barriers that survivors face is actually accessing healthcare. In a survey that was done in 2023, something like 70% of survivors of trafficking said they were struggling to access mental and physical health care. So why is that? What's happening? Where's the breakdown? I mean, there's a lot of doctors and therapists out there, right? So what's not working? Well, one of the biggest reasons that survivors are struggling to access physical health care is because of their trauma. So a lot of survivors never went to the doctor, right? If they started being trafficking when they were 3 years old, the family member trafficking them isn't going to take them to the doctor. So for many of them, they have multiple chronic illnesses that have never been treated. And when they go to the doctor, there's so many questions to answer that are either triggering or just absolutely overwhelming. Nobody wants to go to the doctor and have to explain all of the awful, unimaginable trauma that's happened to them. And yet for survivors of trafficking, in order to even begin to discuss their illnesses, it often feels like they have to talk about the trauma they experienced. And then for other survivors, they've actually been trafficked by medical providers or abused by medical providers, or their trafficker used a medical provider to perpetuate the abuse. Maybe somebody signed off on medication that actually kept the survivor drugged. Maybe somebody said something unkind that brought up the trauma. Maybe somebody said, "Why haven't you been to the doctor for 10 years? Why have you been neglecting yourself? Don't you know that you're supposed to go to the doctor? Don't you know that you're supposed to get help?" Those things that might seem innocent are actually very triggering and difficult for a victim or survivor who's already feeling intense shame and frustration and just overwhelmed with their situation and their healthcare. And so when they know that that's what they're going to experience, it makes it hard for them to go to the doctor. And then even when they do go to the doctor, it can be hard to talk about what they're really struggling with. In the beginning of this year, we did a survey of our clients and found that the vast majority of them do not have trauma-informed or trafficking-informed medical providers. And so we actually created a new partnership with a direct primary care facility. And through that partnership, our clients get day of access to trauma-informed medical care. That means that our clients don't have to explain their entire trafficking in order to get care. They don't have to worry about the doctor making insensitive comments or just saying, "What do you mean you were trafficked? You weren't locked up." Like things like that. Instead, they can call the doctor and say, "I'm struggling with something right now," and get an appointment that day or the next day to get support. And through this partnership, we've seen the lives of our clients be absolutely transformed. One client had chronic illnesses that her existing medical provider wasn't treating because she wasn't comfortable talking about them with her provider. But with this new trauma-informed provider, she immediately opened up about these chronic illnesses and began getting treatment. Another client had an illness that she was extremely ashamed about and unwilling to open up about or talk to a provider with. With the guarantee that we were able to give her that this doctor was trauma-informed and sensitive and aware of trafficking, she was able to open up about this life-threatening illness and get help. Another client was without health insurance because of complexities with her case, and just sometimes you lose health insurance when you're relying on Medicare. Normally that would have barred her from getting care, or she would have had to foot a large doctor's bill at urgent care or the ER. Instead, she was able to call the direct primary care doctor and get help right away. So through this fantastic new partnership, we're able to transform survivors' experience of healthcare and remove a barrier that 75% of survivors are facing.